Hello, my name is Sandra Rawlings. I am with an agency that is a nonprofit. They have inpatient, outpatient, case management, med management, and intensive outpatient services. I currently work with the intensive outpatient services. They also work with doing medication management, and case management. We do group therapy and also manage their individual therapy. So my ethical dilemma is regarding one of our intensive outpatient patients. We're going to call her Allie. So Allie is 18 years old. She goes by she, her pronouns. She struggles really heavily with suicidal ideations. She struggles to the point where recently she has said her only purpose in life is to kill herself. She recently had been released from the hospital, and safety planning was done with her family. They assured everyone that they would watch her and make sure she wasn't alone. Yet we got a call last Monday that asking if she was there. And there is no information release. And so it was this really difficult dilemma of not knowing where she was and being unable to tell them if she was here or not, and her not being able to be found. So now the question is whether to let her back into the intensive outpatient program. When they found her, she had overdosed and tried to kill herself. She went into inpatient, and after only a few days, now they want to release her and they want her to come back to intensive outpatient programming. My supervisor is not comfortable with that, but she is struggling with the wondering what will happen to her if we don't take her back in. So we feel like she needs a higher level of care. However, our inpatient is saying that she's stable enough to leave, which Allie has shown a tendency to be able to say whatever needs to be heard in order to be released. We really feel like she needs to be in a long-term inpatient facility. Some of the other things that go along with this in my eco map that I've attached is she has all these relationships playing a dynamic in this, and she has a sister who died 2 years ago from cancer, and she really struggles with that. It's a big part of her wanting to commit suicide. She also has these really strained relationships with most of her family. Her one part of her safety plan that is very solid is her relationship with her niece and nephews. She feels very strongly bonded to them. However, she has very abusive, strained relationships with an ex-boyfriend and her biological father. She does have stronger bonds with her uncle and her mother, but it's stressful because she feels like they don't care, because when we safety plan and they say they will take all of her pills or her knives, later on she's like, they didn't do any of that. And why don't they care? Do they not care if I'm going to kill myself, in her words? So she really struggles with that aspect of self-worth, and this has led me to using the systems theory when I consider this, just because it's all of the systems in her environment that are really playing a role with the push and pull. She has good experiences in the intensive outpatient program, but again, my supervisor just does not feel like it is a safe environment because we can't trust her safety planning to be effective. So, cultural considerations. As far as cultural considerations, I feel like there's minimal considerations as far as why uses typical pronouns. The one cultural consideration I use quotes is because I feel like it's loose, but it's mental health services in Idaho. There's just a culture where there's not enough. The resources are very limited, and it creates an environment for mental health services to fall really short. And that's just the culture of it being okay. This is not the first scenario where we felt like we are not the appropriate level of care for someone, but pretty much everybody's like, well, that's what it is and that's okay. So we're really struggling with the decision of whether to let her back into our program. As much as the staff wants to be there to help her and feels like any help obviously is better than none, there's also the liability of knowing that she is very high acuity and knowing that we are not the appropriate level of care for her. So do we say no and not allow her in the program and risk her to fall through the cracks in that way? Or do we allow her to have our level of treatment in our facility, in our intensive outpatient programming, and it possibly end up resulting in what happened the other day, but her actually following through? I think that the client's perception of the problem is that she does have a questionable support network. She very much struggles with feeling as though no one around her really cares. She does have some elements of feeling like she has support and nurturing environments from the treatment teams, but she doesn't feel like her family cares if she commits suicide. So she really struggles with finding what that safe place looks like for her. Her strengths is she does have some level of family support. They are involved. There's just very little follow through. Her stated strengths are that she's smart and personable. She's a good person, in her words. She can identify there are positive aspects of life, so that is a strength. Her limitations are just a very limited insight into just life and options. This has taught me that it's just really hard to be able to know that when you might not be able to give the right amount of care to somebody, whether that's as an outpatient therapist in an intensive outpatient program. It's just shown me that it's really hard to want to be there for someone and give them care and not, as my supervisor says, just pushing them on somebody or dropping them. However, it's also very serious. The liability ramifications, also just really insisting and advocating that she get a higher level of care. So it's also through it just shown the boundaries of my supervisor has also struggled with boundaries of having people be able to call her 24/7. And finally, between this patient and another patient, she just really had to set those boundaries of there's the crisis line, the hotlines, and the inpatient hospitals, and those are the resources, and just setting boundaries for yourself as a provider so that when people do need care outside of hours, you can't be available 24/7. So that is my ethical dilemma, and I appreciate you listening.